It's about a patient who lost a part of her iris and her lens after penetrating trauma a pair of months ago. She had a primary reconstruction and secondary sclerofixated IOL, and now I am showing a partial artificial iris implantation following the technique showed by Peter Schurman. A frown incision is made. Make sure that you see your knife in the corneal limbus before you penetrate the eye to have a sealed wound. Then I do trepanization of the iris implant to make it a little bit. Then a fixation is prepared using a double running Prolene 10-0 suture and fixating the iris at 3 points. Then the Prolene sutures were fixated using the Z suture technique with going 5 intrascleral runs parallel to the limbus at the level of pars plana to get a knotless fixation of the Prolene sutures. This technique is also described by Peter Schumann to avoid slipping of the knot or the problems of erosion in the sclera. You can see here sweeping of the needle through the tunnel not to engage any tissue and then to retrieve the needle with 27 gauge needle through the sclera to get exactly out at the point where you want. And then the iris is introduced inside the eye. Here are the set sutures which are done parallel to the limbus intrasclerally. And then are cut without putting a knot. The is begun at the edge of the frown incision, then suturing the pupillary borders using the sliding knot technique for the iris suture. The iris sutures were retrieved also under um, protection of the push-pull, not to pull on the iris tissues or on the implant tissues. Preoperative picture of the iris, and this is the post-operative results. Thanks for watching.